very warm good morning to each one of you present here in this hall today. It gives me immense pleasure to welcome each and every one of you in this uniquely insightful session, Hriday Ki Baat, Dil Se, Heart to Heart and Wellness Insight for Finance Professionals. In a world where the pursuit of financial excellence often takes precedence, we find ourselves here today to delve into a crucial aspect that sometimes take a backseat: the wellness of the heart and soul. As finance professionals, the demands on our time and energy are significant, and understanding the importance of holistic well-being becomes important. Today's session promises to provide profound insights into the harmonious integration of wellness practices into our professional lives. We are honored to have with us distinguished, esteemed panelist and a keynote speaker, who has not only excelled in his professional domain, but also recognized significance of holistic wellness in our fast-paced lives. Without further delay, please join me in welcoming the first and the only keynote speaker today, a doctor with over 25 years of experience on intensive care and clinical cardiology, non-invasive cardiac investigations, and all cath lab procedures, has more than 200 seminars to his credit. None other than Dr. Urmil Shah ji. Sir, I request you with a huge round of applause to please come up on the dais and take a seat. Sir, please. So we are all eagerly waiting to hear your insightful session. So I think won't take much time between you and the audience. I request you to please come up and share your insights with us.
Good morning, everyone. Thank you very much for inviting me for this occasion. People, all chartered accountant dealing with the business. I'm the only one probably having a different profession at present. So I'll be discussing something related to heart. First of all, I would like to congratulate all of you, because last week I heard that maximum IPO investment has been done. Some 3,75,000 crores. That is highest probably in the Indian history. So I would congratulate all of you for this special thing. Now, similarly, let me start my talk by this statement. Knowing is not enough, we must apply. Willing is not enough, we must do. Meaning by some of the things which I'm going to tell you already know, okay, but you are not applying in your day-to-day life. Something you really want to do, okay, willing to have a good heart, good health, but you probably are not doing. So you must do something if you really want to achieve something. So that is the message I wanted to give. This is a good news. In the Western world, if you see over years, the cardiac problem has gone down, primarily because of risk factor modification, which is important. They have understood, they have just modified their life. And that is the reason why overall mortality, morbidity related to heart disease has gone down. But that is not the scenario in the Indian setup. If you look at the Indian setup, definitely compared to 1990, if you look 2020, 2016, the cardiac disease are increasing. We all are aware of this reality. Second, if you look at this, probably incidents are increasing, and especially at the younger age. We all are aware that previously we used to have the cardiac problem up to the age of 45 or 50, but nowadays persons are also coming with the cardiac problem. So previously it was an elderly disease. You come across many of these news in your newspaper that suddenly a person was playing cricket or doing garba or something, and suddenly he died. Okay, so it may be someone is blaming it's because of COVID, someone is blaming because of COVID vaccine. There is no proof for that, but definitely we do come across patients who are having sudden cardiac death, especially young age. And we have to differentiate whether it's a cardiac arrest and cardiac heart attack. Every time it is not heart attack, okay? It may be a cardiac arrest because of some rhythm problem, some other problem. It's not necessary. But one of the important cause of sudden cardiac death is heart attack, what we commonly know in our day-to-day life. Which are the risk factors for the heart disease? Dietary risk is most important: blood pressure, air pollution, cholesterol. tobacco, fasting sugar level, and obesity or high BMI. These all are very important. WHO has predicted way back in 2010 that in 2020, 2025, the heart disease are going to be increasing in our country. And this is what we see reality at present in our day-to-day scenario. And this is what, because after 2010, there was a great economic development because of India is a progressive growing country. And because of that, good infrastructure, good automobile, and our workplace has changed. Okay, from farm, now we are sitting in the office and doing our work. Probably that is the reason why all sorts of cardiac problems occurring. And that has basically led to a tsunami of obesity, diabetes, hypertension, dyslipidemia, and ultimately heart problem. So intellectually, all power pack generation, young generations are going to face this problem. This is what has been predicted way back in 2010. Now, these are the animals who does not have heart problem. Okay, and what they're doing, they are continuously wandering all throughout the day in the jungle. Okay, and what they eat basically, they basically eat the grass. So what we have to understand is something similar we have to do if we really want to avoid ourselves from a cardiac problem. And this is what the evolution, our genes or we are made for walking, we are made for working, but because of whatever thing which has occurred in last maybe for 40, 50 years, we are just sitting in the TV, sofa and seeing a TV and maybe eating some fast food. So that is a scenario which has changed, and that is the reason for all sorts of cardiac problems. What we have to keep in mind, whatever we are there are because what we eat. Okay, so be careful when we are eating something. This is what is happening nowadays. Most of our people, especially the younger generations, are fond of this thing. And that is the reason of many a times this kind of obesity, childhood obesity, which was not seen previously. Okay, our young generations are having this kind of abdomen, and which is causing all sorts of cardiac problem. What I always call junk food is fast food, which cause fast plaque. Fast plaque means there is a blockage inside the artery, and it ultimately leads to a fast death. It has a very poor nutritional value. It is very high in the calorie, high in the salt, high in the carbohydrate, and does not have any vitamin or nutrient. So that is the reason it is not good, and it can cause obesity and dyslipidemia. So pizza, burger, French fries, all junk foods, few moments on lips, forever on the hips. So always, whenever you are eating, keep this thing in mind that whatever you're eating ultimately going to cause some sort of problem. Regarding the carbohydrate, bread it's like a sun. It rises in the east and sets in the west. That means if you are eating a carbohydrate, ultimately it is going to be deposited inside the waste. So that is the thing we have to keep in mind. Who says I'm ugly? It's not only because of problem of ugliness. It is because we have a heart problem, because we have other problem. That is the reason we have to maintain our diet and our body. First wedding anniversary, we made something like this, and on 25th, we made something like quite different, which as such should not be there. So that we have to keep in mind. Vajan ghatao, beti bachao. Okay, so this has to be message. If she doesn't, she might fall also. So really we should reduce the weight in most of our patients. When phone is 98% charge, still we charge. Okay, and that is what probably we are doing in our day-to-day life. Okay, we are full, still we eat more and more, and which is causing all sorts of problem. It's something like a body tribe, which is in Ethiopia, where these kind of persons are preferable. Okay, for the marriage purpose. Okay, but we have to keep in mind it may be for good for that purpose, but this may not be good for cardiovascular problems. So that we have to keep in mind. Yoga अच्छा है, इससे definitely वजन कम हो जाता है, but that is not we basically did not want. The shortest and the simplest way to reduce weight is this. Okay, just put a calculator or something there and whatever weight you want to choose. There are people who thinks that प्राण जाए पर वजन न जाए. मेरा वजन तो कम नहीं होना चाहिए, whatever it may cause problem. Why it is important? Why we are discussing? Because ultimately BMI or an obesity leads to all sorts of cardiac problem, all sorts of neurological problem. So hemorrhagic stroke, cardiac problems are much more if your BMI is high. This is we have to keep in mind when we eat burger. We are going to be like this if you eat burger so frequently. We should be having burger like this. Okay, which is basically made up of no carbohydrate, no fat. It should be a more of a fruit, what we should be eating as such. Basic thing is this is a diet spoon. Okay, you have to eat with this spoon if you really want to reduce. Meaning by you have to really cut down your daily intake. That is probably most important. And other thing is diet modification. Okay, what we are eating right now is what we should not be eating. We should be eating more of a protein. We should be eating more of a fiber. We should be eating more of a nutrients thing like vitamin thing, protein. But what we are doing is we are taking more of a carbohydrate. We are taking more of a fat. So our diet over years have changed. So we really need to do something, modify this if we really want to improve the cardiovascular problem. Saturated fat is the important thing, which is what we call as the animal fat, which comes in ghee, butter, cream, whole milk, cake, pastry, biscuits. This basically cause increase in the LDL. Okay, and LDL we all know is a bad cholesterol. It causes all sorts of problem. Second part of the cholesterol is a polyunsaturated fat, and this is basically protective. Okay, why it is protective? Because it reduces the cholesterol level. These are the things which have like sunflower, safflower. These are the things which are there, but it also increase the HDL. So it may not be a very beneficial thing. So good oil, what we can call, it should reduce the LDL and we should increase the HDL. These are what we can call as a mustard oil or a canola oil or the olive oil or the peanuts oil. So these are the oil basically which can reduce the LDL and HDL cholesterol to the higher level, which is beneficial as far as heart problem is concerned. These are the fat composition of different oils which are available. If you see the mustard oil, basically has the least component of saturated fat, meaning by that is a very good oil. If you want to see what is there, ghee, butter, which you are eating, has a very high saturated fat, which is not good for our health. Coconut oil, if you see, which has a 92% saturated fat, which is not good. So these are the, just you can have idea that which is the oil which we should be using in our day-to-day life. If you reduce the saturated fat intake, definitely it can reduce the LDL by about 10 to 15%. Overall cholesterol, if you do a weight loss, if you take more of a nuts, especially almond and this on fiber intake, if you increase, definitely it can reduce the LDL. So if you have a good diet, practically we can reduce about 10 to 30% of the LDL, which is going to be useful. What regarding the coffee and tea? Coffee and tea, if you are having a tea which is not with the milk and with the sugar, it's fine. But if you add milk and sugar, it probably does not take the advantage of the, and coffee, maybe 1 or 2 cups should be fair enough, but more than this is going to cause problem. These are the easy steps. You can take a small frequent meal, good number of water you should be taking, take a good breakfast. And what should be more in our daily life is more of a fruit, vegetable, nuts, fish if the person is non-veg, and tea, 1 or 2 without milk and without sugar. That is important. And we have to really minimize the intake of sugar, caffeinated drinks and dairy products, which should not be there. And of course, we can take one thing which you like. Okay, if are fond of eating something, one small dish of something which you are preferring, you should be taking. Otherwise, you should avoid. Can anyone tell which is the most dangerous of all these things? It is alcohol, smoking. Or so basically, it's a chair which is causing all sorts of problem. Okay, why? Because why? Because if you sit prolonged, okay, it has been found over years. Like this is the study which was done in 1953 in British, where a bus conductor and bus driver. So bus conductor used to have less cardiac problem compared to the, bus driver. Meaning by the person who is walking, who is standing, are going to have less problem compared to those who are sitting. So that is a message which we know since very long years. And this is what has been recently also found. Sitting is equivalent to smoking. We many a time think smoking is very dangerous. Okay. What we have to keep in mind, sitting also is going to be similarly dangerous. And it has found that if you do a little bit of walking in between your day-to-day practice, maybe 2 or 3 hours, is going to cause good as far as heart is concerned. Exercise basically prevents cardiac problem because it reduces the obesity, it increase the HDL, it reduces the LDL, which is the bad cholesterol. It helps to control diabetes and blood pressure very nicely. So it is very beneficial also. Many times we think that I'm having an ideal weight, I'm thin and lean, why I should be doing exercise? Okay, there are so many advantages of exercise we have to keep in mind, because it can strengthen heart, lung, bones, muscle. It will give a good energy, good strength. It will be able to, if you're doing a good exercise, you can handle the stress very nicely. You will have a sleep better, good sleep, a good look will be there, and you always feel upbeat and confident. That is the advantage of doing a regular exercise, what is recommended. Now this guy is sitting, his dog is on the treadmill. Ideally, he should be on the treadmill, and he is drinking something which he should not be eating, maybe Coke or burger, okay? Doctor asked me to spend 1 hour on the treadmill, and that is what that guy is doing. Okay. So that we have to be careful. Many times exercise is little tedious thing. We may not like it. This is a good thing. Guy is sleeping, thinking that he is having a good cycling, what he is doing. So which kind of exercise? Just walk. Okay. What I always tell is it should be a brisk walking where you get little bit of perspiration, little bit of fatigue. That should be regularly, maybe about 40-50 minutes a day, at least 5 days a week. That is what has been recommended. And it basically, you can use a bicycle, you can do a swimming. So this is all cause of. So exercise, as I've told, jogging, cycling, bicycle, treadmill, staircase climbing, aerobic dancing. These are all the exercise which are good as far as heart is concerned. Myth is obesity runs in family. Okay. And I always tell that it is because no one runs in the family. That is probably the reason why person is having obesity. Otherwise, there is no reason that obesity should be there. This clock you always have to keep in mind. Okay. The movement maximum is the slimmer. Okay. So that also we have to keep in mind. So more you run, you're definitely going to be thin and lean. Exercise basically cause resting heart rate to go down. It can cause the blood pressure also to go down. It will increase our basal metabolic rate. So whatever by chance we are eating little bit more can be metabolized. That is a real advantage. Bone composition, mineral, everything is going to increase, will be good. Glucose metabolism will be good. As far as LDL, HDL is concerned, LDL is going to go down, HDL is going to go up. So it is going to benefit. So there are tremendous advantages of doing a regular exercise. This is also 100 kg weight. This is 100 kg weight. Okay. What we should be, our body should be composed more of a muscle rather than more of a fat. Okay. So that is the scenario. If you change your diet, if you do the exercise, this change we can achieve. Doctor told me to burn some fat, and this guy is trying to do burning some fat. Sometimes we are all healthy. We don't have any motivation to do exercise or a diet. But sometimes it may happen that you come across hypertension, diabetes, and then doctor force you. Okay. So motivation then automatically comes. So it is before that you get self-motivated and start doing a good lifestyle modification. What basically does exercise is muscle performance, stability, postural, mobility, flexibility, neuromuscular control, everything will be good. Heart and lung, everything will bone, muscle, everything will be strong if you do a regular exercise. 40 પછી 40 મિનિટ 40 નહીં તો તું ક્યાંય 40 નહીં. So always remember those who are person more than 40 years should be regularly walking. Otherwise, you are not going to be there in the market. Okay. Second thing is, sometimes we feel that I'm too young to start exercise program. Okay. What you to keep in mind, do regular exercise so that we always remain young. Okay. So our purpose should be start exercising even at the younger age. We want to remain young forever. The problem with exercise is I joined gym last week. I cannot believe in just 3 days, I lost. So that is the common scenario which we come across. So maybe you can get a good company or some motivation to have a good walking. Some myth is one should not have an addiction in the life. Okay. I would say one addiction should be there, and that is exercise. Okay. Once you start doing exercise, it becomes such an addictive thing that if you then don't do exercise in the morning, you don't feel good whole day. So start doing exercise on the very regular basis. After maybe 15 days, 1 month, you get so habituated that you will not be able to then stop the exercise. Which gym is best for a cardiac problem? Nature is the best gym. Okay. You can walk around the nearby area where the good environment is there, good greenery is there. That is probably the good thing. Second important myth is this, very many times we come across. I run 5 kilometers before 2 months. I went to Ambaji and do a climbing and all this thing. Now I had a chest pain. So it cannot be a cardiac problem. I always tell to that it's not necessary. Whenever you have a symptom, don't ignore it. It's not necessary that before 15 days you have done some good exercise and you don't have any problem. Right now you have a symptom, don't ignore. Go to the doctor, consult it. It may be a cardiac problem. Okay. Exercise, as you can see, light exercise, moderate exercise is by and large enough. There is no need to do heavy exercise, but overall is going to benefit as far as cardiovascular problem is concerned. This is, I always tell, this is called as a recycling. Cycle ચલાઈને આપણે થાક્યા એટલે મોટરસાયકલ લીધી. After motorcycle, we went for a car. Car પછી આપણે gym join કર્યું and ultimately cycle પર પાછા આવી ગયા. So this is what the scenario. Okay. મારો ડ્રાઈવર મને કહેતો હતો કે સાહેબ રોજ સવારે હું આવું છું, મોટી ગાડી ચલાવું છું અને તમને લઈ જાઉં છું જીમમાં, ત્યાં આગળ તમે સાયકલિંગ કરો છો અને હું આવું છું પોતે સાયકલ ઉપર. So this is the scenario which is happening our day-to-day life. We know that there is going to be benefit of the exercise, but always remember that when you start exercise program after the age of say 45, 50, you have to be a little bit careful because many times you're not exercising and you start doing a vigorous exercise, sometimes it may precipitate. So basically it should be under the observation of what we can say a medical professional or some guidance so that it does not cause any harm. Because many times we have seen that exercise does cause problem. ડોક્ટરને કહેવા પ્રમાણે આપણે જઈએ તો ઇટ ઇઝ વોટ વી કોલ એઝ અ મોર્નિંગ વોક. ડોક્ટરને કહેવાથી ના ગયા પછી બીમારી થઈ જાય એન્ડ ધેન ઇફ યુ ગો ઇટ ઇઝ કોલ એઝ અ વોર્નિંગ વોક. પોતાની પત્નીને કહેવાથી આપણે ચાલુ કરીએ દેટ ઇઝ વોટ વી કોલ એઝ અ ડાર્લિંગ વોક. બીજાના શરીરની ફિટનેસની ઈર્ષ્યાને કારણે આપણે જઈએ દેટ ઇઝ કોલ એઝ અ બર્નિંગ વોક. એન્ડ પત્ની સાથે ચાલતા ચાલતા બીજા ફિમેલ્સે જોતા જઈએ that is what we call as a turning walk. So these are basically the type of different walk which we can keep in mind. Vigorous exercise is beneficial to everyone. Okay, as I was told, a mild to moderate exercise is by and large fine. There is no need to do a very vigorous exercise time. It can precipitate the cardiac problem. We do come across કે જીમમાં ગયા આપો એક્સરસાઇઝ કરતા ત્યાં suddenly collapse થઈ ગયા or marathon run કરી અને પછી collapse થઈ ગયા. So it should be gradually increase. It should not be very fast. Now, my cardiologists many a time that when you do angiography and we tell them there are multiple blocks, you need to go bypass surgery or angioplasty, they say, no. Now I realize I heard the lecture of Dr. Urmil Shah. He told me that you should be doing good diet and good exercise. Probably that is a late time. Okay, that means you have not taken care for the initial years. Now it has caused a severe problem. We should not be. You have to do whatever is told by the doctor, like maybe angiography or a angioplasty or a bypass. And if you do it, and then what you have to have a good lifestyle. Okay, because we don't want a further damage or further disease progression. But what is done should be taken care first, and then we have to do something for the preventing all this. I love this course. Very costly, then come to the hospital. Okay, you'll find how costly the deal will be when you come to the hospital. Smoking is very bad. We all know it is dangerous. It can have a cardiovascular problem, especially heart problem. Smoking ban box પર લખ્યું છે cancer થાય વધારે, સાથે ઉપર લખવું જોઈએ કે cardiovascular problem બી થાય because it is a direct correlation with the cardiovascular problem. What basically it causes is it increases the HDL. It decreases the HDL, increases the LDL. So that is the bad thing which is as far as heart is concerned. And we know that our younger generations are many times motivated by all this thing. Stress is an important factor. We all know there is no direct measurement of the stress. Okay, so that we cannot, like we can measure blood pressure, we can sugar, we check cholesterol, but there is no, it is basically an individual response, okay, to the situation. So that basically we have to keep in mind. Some stress is important. Okay, if you have a little stress, it is going to improve your performance. But if the stress is persistent and chronic, ultimately it is going to cause more of a cardiac problem. Stress ne karane shu thai? You will feel angry, you will afraid, you will feel excited, you will feel helpless. Sleep is disturbed, you have a body pain, you may have start smoking or try to take tobacco or drinking, overeating, drug abuse. These are all also problem, and you may look something like this. And if you take care of the stress, it should be looking like this. Okay, so there is a big difference. So person who is under stress versus under not having under stress. So this is not the way we should be reducing our stress. Yoga and meditation is important part of our life. Believe me, it is going to cause a tremendous advantage. It can make our mind very peaceful. And we all know that there are certain psychosomatic disorder. That says if you just do a body checkup, no abnormality will be found. But patient may be having multiple symptoms. Okay, these are all because of brain, not because of real structural problem. And in WHO, it is said that health is not only a physical fitness, it is also associated with the mental fitness. So mental fitness is definitely we are going to get by the yoga and meditation. Pain is inevitable, but suffering is optional. Okay. Certain situation painful, hoy, but everyone will not perceive the same suffering. Okay, it is because of our mind. If you're strong in our mind, that pain will be much milder to us. So that we have to keep in mind. What are the advantages of meditation? As you can see, it will keep our physical, mental, emotional, and spiritual health. Stress relief થઈ જાય, anger, fear આપણે સારી રીતે કરી શકીએ, better concentration, improve our performance, interpersonal relations will be good, and definitely it can cure and control the psychosomatic disorder, as I have told, brain and something else like diabetes, hypertension, asthma, rheumatism, all will be significantly reduced with this. Health conditions which are beneficial by yoga and meditations are arthritis, allergy, asthma, hypertension to some extent, coronavirus to some extent, irritable bowel syndrome, acidity, which is very common with the stress, constipation, tension, headache, migraine. These are all the symptoms which are more of, if you just do a checking, nothing will be abnormal. But it is because of your mind, which is not good. You have to live in present. Okay. Here is someone who wanted to be happy tomorrow. Okay, we don't want to be like this. Okay, remember that whatever the present situation is there, there is nothing like after 5 years I will be having this, I will be having this, and then I will be happy. You have to be happy today. Okay, because we don't know when it's going to cause some thing. Money is not all. Okay, we have to be happy. Okay, someone can be happy even without money, and someone may be very unhappy with an ample amount of money. This is the example. This is the guy who has come first, and this is the guy who has third. Okay, the third is more happy. So it's not that you have to set your mind in such a way that you remain happy in most of the situation. Now, as far as lifestyle modification is concerned, we have to understand that if there is someone tells that if you're having blood pressure, I will take the medicine for blood pressure. Why I should do a lifestyle modification? If there is a cholesterol, I will take the medicine for the cholesterol. It is not that, because lifestyle has a multiple advantages. Okay, it is not only the cholesterol medicine will reduce the cholesterol, blood pressure medicine will reduce the blood pressure. But if you do a lifestyle modification, it can reduce the weight, can reduce improve the cholesterol, it can control the diabetes, it can control the mental stress. So every advantages are there. So we have to have a lifestyle modification along with the medicine which has been recommended by doctors. Another thing is beyond heart. Okay, if you stop smoking, if diet is proper, if physical activity is good, if you're not taking too much alcohol, there are so many other advantages. It's not only cardiovascular, like cancer, diabetes, lung problem, osteoporosis, mental health. Everything will be good if you have a good lifestyle modification which is recommended. Object in the mirror. This is for the all chartered accountants sitting over here. But as far as heart is concerned, this is a Yamraj. Okay. So the object in the mirror is Yamraj. He may not be too far from you. So you have to be careful. Okay. That is the message I wanted to give. So think before eating, do a regular exercise, which is very good. This is the poem which I always tell. It is in the Gujarati. I don't know, some of the people may not understand, but I will try to make it a little bit Hindi. આજે સવારે મારા હૃદયનો ફોન આવ્યો. એ મને કહેવા લાગ્યું, બોસ, હું તમારા માટે વિના અટકે 24 કલાક ચાલુ છું, પરંતુ તમે મારા ખાતર 1 કલાક પણ ચાલતા નથી. આવું ક્યાં સુધી ચાલશે? જો હું અટકીશ તો તમે પણ જશો, અને જો તમે અટક્યા તો હું પણ જઈશ. તો ચાલો એવું ન કરીએ કે આપણે સાથોસાથ ચાલીએ, સાથે રહીને જીવનભર. બોસ, હજુ પણ સમય છે. કાલથી તમે ફક્ત 1 કલાક મારા માટે ચાલો. મારું વચન છે કે હું અટક્યા વગર 24 કલાક તમારા માટે ચાલતો રહીશ. તમારું પોતાનું હૃદય. So this is the message basically tells that if you do a regular walking, it's going to be beneficial as far as heart is concerned. If heart is there, ultimately we are going to survive. That is the message which we really wanted to give. Again, the first slide. Knowing is not enough. We must apply. Willing is not enough. We must do. As I have told, some of the things you are already knowing, but you are not applying in your day-to-day life. Willing is also there, that we should be having a good health, okay? But we are not doing enough to make our health or our heart really better. So that, again, message I want to stress. So whatever you have heard, just follow in your day-to-day practice. That is probably very important. And this is probably the last thing. It is not related to the heart disease, but related to the organ donation. And this is the video.
दिख नहीं रहा? अपनी 3 करोड़ की गाड़ी में आग लगा रहा हूँ।
अरे तो तुम गाड़ी में भी लगाने क्यों, वो भी इतनी महंगी गाड़ी में? जरूरतमंद को दे दो, अपने किसी दोस्त को दे दो, और अगर कोई नहीं है तो हमें दे दो फिर।
क्यों दे दो भाई? मेरी गाड़ी, मेरी मर्जी, आग लगाऊं चाहे कुछ भी करूं। भले ही लाखों लोगों को इस गाड़ी की जरूरत होगी, पर मैं नहीं दूंगा, मैं तो इसमें आग लगाऊंगा।
अरे तो इसे जलाने से मिलेगा क्या?
मिलेगा क्या? अरे जब मैं मर जाऊंगा ना, तब मेरे काम आएगी, ऊपर चलाऊंगा इसको।
अरे पागल हो गया क्या? एक बार ये जल गई तो फिर किसी काम को नहीं रहेगी।
आपको क्या पता ये मेरे ऊपर काम आएगी या नहीं आएगी? आप मेरे साथ जाओगे?
अरे हाँ पता है, मरने के बाद ये शरीर तो साथ जाता नहीं, ये तो फिर भी कार है।
सही कहा आपने। ये मुझे दुनिया का सबसे पागल इंसान लग रहा है, जो अपनी इतनी महंगी करोड़ों की गाड़ी में आग लगा रहा है। सच में बिल्कुल ही पागल है ये।
मैं गाड़ी में आग लगा रहा हूँ तो मैं पागल हूँ? और ये जो लाखों लोग जो कर रहे हैं वो सही है?
क्या मतलब है तुम्हारा?
मतलब ये तो सिर्फ एक कार है जो पैसों से कहीं भी मिल जाती है, लेकिन हम अपने शरीर के साथ ऐसी कीमती चीजों को जला देते हैं जिससे हम लाखों लोगों की जिंदगी बदल सकते हैं।
हम कुछ समझे नहीं।
मैं ये कहना चाहता हूँ कि जब किसी की डेथ होती है तो उसके साथ साथ ऐसी कीमती चीजों को जला देते हैं हम जिससे लाखों लोगों की जिंदगी बदल सकती है। जैसे हमारी आंखें, हमारी किडनी, लीवर, जो बहुत कीमती है, जिससे हम लाखों लोगों की जिंदगी बचा सकते हैं, उनको हम ऐसे ही जला देते हैं। मैं इस गाड़ी में आग लगाने वाला था तो आप लोगों ने, सबने मुझे पागल बोल दिया। अरे हमारे देश में ऑर्गन्स की इतनी कमी है कि लोगों को मिलते ही नहीं है, जिसकी वजह से लाखों लोगों की जिंदगी जाती है। अगर हर इंसान अपने ऑर्गन्स को डोनेट कर दे तो सोचो हम कितने लोगों की जान बचा सकते हैं। सिर्फ एक आदमी बहुत सारे लोगों को एक नई जिंदगी दे सकता है।
अरे बोलना आसान होता है, पहले खुद डोनेट करके आ, फिर पता लगेगा। और वैसे भी तेरे जैसे ज्ञान देने वाले बहुत आ गए और बहुत जा भी चुके हैं।
मैं सिर्फ आप लोगों को बोल नहीं रहा, मैं 10 साल पहले अपनी पूरी बॉडी डोनेट कर चुका हूँ।
हैं?
और मैं इस गाड़ी में कोई आग लगाने वाला नहीं था। मैं तो सिर्फ आप लोगों को एक मैसेज देना चाहता था कि मेरे इस गाड़ी।
So this was basically the message as far as organ donation is concerned. We do come across so many patients who are having severe heart problem, who are having liver problem, who are having kidney problem. They are waiting for someone to have a donation, I mean organ donation, and ultimately get an heart or lung or liver. And many times we have seen so many patients who die in between. Okay, so it's just a request to the august audience that just think about this. It's nothing wrong. If you are dying, many times patient does not, person does not understand at that time when the person is dying, or the family, there is some good mindset at that time. But if you are clear, because right now you are having a very comfortable stage, okay, so at that time you can decide that I really want to donate when any organ, if it is needed, there is some brain dead person and heart, liver, kidney, something required. The first person liver transplant which we did in heart transplant on 2016, the guy was a 21-year guy from Bhavnagar. He had a severe head injury because of accident. He was going to die. He just donated, and from that we can get 1 heart, 1 liver, 2 kidney, and something else. Lung at that time was not used because we were not doing lung transplant. But probably a 5% can get benefit: 2 kidney, 1 liver, 1 heart, and lung. So just keep things in mind. If your friends, relative, are by chance dying and doctor is telling that is brain dead, there is no chance of, so you are going to the home, okay, ultimately you are going to do a routine rituals. But request you, if you can think about this, it may be beneficial to so many patients. Thank you very much. If there are any 1 or 2 questions, we can take if we have time. Yes sir, yes sir. Yes, it's going to take care of all donations. Okay. So what we are going to do whenever the patient is brain dead, and we are telling that we just have to confirm that it's a brain dead. It is a standard way of managing that brain is not going to be again back. So practically, normally we tell that when the heart is stopped, person is died. Similarly, if brain has stopped, brain is totally dead, then also it is a as such a death as far as definition is concerned. So for all the purpose, it is a dead person. Okay. And that is the reason why we tell them that there is no need. You can keep the good patient home. At that time, if the person is donating, all the organs can be benefited. Okay. So what we do, we check his liver, we check his kidney. It may happen that someone may have a liver problem. So we cannot take liver, but we can definitely take his heart. We can definitely take his kidney. If someone has a kidney problem, if liver is fine, we can take the liver. So just have to donate the whole body. Whatever organs are good and which can be used for the other person, we are going to use it. Yes. Yes, sir. Good.
दिन में मॉर्निंग में सर 1 घंटा मैं वॉकिंग करता हूँ सर, और 45 मिनट तो सर बॉडी का जैसे ऐसे किया, यूं किया हाथ.
That is the real good thing you are doing. And as I have told, this is what we call as addiction. Okay, the person who is addicted to smoking will be not good if doesn't do smoking. Person who is having tobacco will not feel good if he doesn't use the tobacco. Similarly, your body is addicted to the exercise, and that is what I told, that addiction, best addiction is exercise, yoga, or meditation. Yes, sir. Yes, so that basically I have not taken it, but normally what is recommended is you routinely after the age of 40 will get blood pressure, sugar, and cholesterol checked, and BMI, that is what we call as a body mass index. These are the standard 4 parameters we check. From that we can have a risk calculator. So from that we can predict that over years, after 5 years, 10 years, how much is the chance for developing your cardiac problem. Okay, and if it is more than 10%, then certain extra precaution also should be taken. So there are a good scientific way of identifying. If the person is having a strong family history, maybe at the age of 30, he should check his cholesterol. Otherwise, all other patients after 40, and it should be repeated at least 3 or 4 years regularly up to the age of 50 years, and after 50 every 2 years. And it's going to be mainly, there are so many other tests like available like calcium score. Now, calcium score is a very simple test which can tell that whatever cholesterol or some risk factor is there, whether it has caused any cardiac issue or starting of the cardiac issue. If they are there, then we have to be more cautious. We have to be treating those patients more aggressively. And it's going to be mainly with the medicine for the cholesterol. Okay, so if you take cholesterol medicine in this group of patients where CT calcium score is high or their baseline cholesterol, it is long run, we have found that it is going to be beneficial and it can delay the development of a cardiovascular problem.
I agree. This is a very interesting session. This question answer won't end anyway. We'll take this offline and in the tea break. We'll take this offline, sir, please. Please, let us respect. We are having one more session. We are having one more. Please have it.
एसिडिटी का मेन सॉल्यूशन है डाइट में late diet should not be taken. Okay, first and foremost thing is you have to eat around 7 o'clock, maybe 6 o'clock, and do some good walking or exercise. That is going to benefit. Otherwise, it's going to cause acidity more. I think we have to stop. Yeah.
I'm so sorry. I have to cut down in between but trust me, I'm the most inappropriate person standing here who is doing the MOC of this session. As my council members were doing their morning walks, I was enjoying the samosa and jalebi in the Leela's breakfast. And apart from Nathi Che, who in the poem, I could not understand anything else that was there. Thank you so much, sir. And we are deeply indebted for your insights and commitment to the wellness of the finance professionals and people at large. I request now the Central Council member from Visakhapatnam ji, Visakhapatnam CA Prasanna Kumar D, sir, to please come up on the stage and give the keynote speaker a memento as a token of appreciation. A huge round of applause, ladies and gentlemen. You have not laughed so much in any of the technical sessions as you have done today. Amiji, we are having a session in the main hall. Yes. In the main hall. So, ladies and gentlemen, the next session, which is about to start, it is in the main hall. I request you all to please take your seats there. Thank you so much.